I'm Marlene Camacho-Rivera, Assistant Dean for Student Affairs and Assistant Professor of Community Health Sciences at SUNY Downstate School of Public Health. As a proud Latina, daughter of Dominican and Puerto Rican immigrants, and a first-generation college graduate, I'm thankful to ASPPH for inviting me to share my story. My cultural backgrounds and lived experiences are at the center and motivations of my commitment to public health and health equity for as long as I can remember. When my parents came to the United States, I was born and raised in the East New York section of Brooklyn, New York, which is a neighborhood that was full of vibrant Caribbean immigrant families, but was also suffering the health and socioeconomic consequences of systemic disinvestment. My father owned a bodega, and my mother worked first in factories and then in housekeeping. And through all those years and sacrifices, they supported my education, not just as a mechanism for my own individual advancement, but as a tool for collective action and positive social change. And on my path towards a career in medicine, I found my true calling in public health. And as a social epidemiologist, my research, teaching, practice focuses on understanding and addressing the roles of structural and social determinants of health in chronic disease outcomes impacting urban minoritized communities. In my role as Assistant Dean for Student Affairs, I'm actively working towards strengthening our public health workforce through holistic admissions, development and implementation of pipeline programs, oversight of student success programs, and creating an inclusive and equitable student environment. And while there have been some improvements in increasing diversity, for example, among undergraduate public health programs, especially at the graduate level and at the faculty level, with only 4% of public health faculty identifying as Latinx, there's a lot of work to be done. But within ASPPH, through my service on the DEIJ Advisory Committee, and in my advocacy work through the Latinx Public Health Faculty Collective, I'm constantly reminded of the strength and importance of my Latino heritage in providing a voice to my community and to advancing health equity for all.